Shall we get started?
Absolutely. And Kat's here.
Hi,
so
everyone.
Kat's from Whitstead.
Cool.
Awesome. Okay, so I think we're having a little issue with the video, everyone, but I just wanted to welcome, it's Tina here, and just wanted to welcome Holly Hodgson from ManageMyHealth, who has, as everybody knows, we've been going around kind of preparing practices for a transition to healthcare homes, and one of the things that people expressed an interest in is knowing a bit more about ManageMyHealth and how it's evolved and how to get into some of the back ends and change settings and things. And so we've met with Holly, who has been absolutely wonderful and put together a presentation for us. So I'm going to stop talking now, Holly, and welcome and thank you for doing this for us.
Oh, thank you. And thank you for the introduction. Kia ora, everyone. I'm Holly. So I've worked with ManageMyHealth before, and I've been around in primary care for quite some time. So I've got a nursing background, practice nursing and urgent care, and have been a patient with ManageMyHealth over the years. So I am working with ManageMyHealth to sort of provide a link between the technical team and end users and how practices need to use ManageMyHealth as a tool. Joining me today on the call now is Francesca McGregor and Tyson Somerville, both of our account managers. You may or may not have met with them yet, and also Andrew Maslin, our GM of operations. So like Tina said, the purpose of today is really to just talk you through the functionality and how it has evolved and what it might be a bit different now to what it was when you first signed up, or you have changed roles, so you might have a bit more to do with the setup that you never had before, and also just a little sort of open session on how other practices do use certain functions that works really well in their clinics. So it's always nice to share other people's tips and tricks as well. If you do have questions, definitely ask them either in the chat, which I can see some of you are asking, commenting, which is fabulous. We'll either answer them at the end of the session, or if you ask a hard question that I don't know the answer to, we'll find the answer for you and touch base with you over the next couple of days. So what I'll do is turn my video off and I will start my presentation. Hang on a minute. Okay. Oops, that's the end of the presentation. I might as well start at the beginning. Okay, so you should all be able to see my screen here. Can you see that all right, Tina?
Yep, absolutely.
Cool. Fabulous. So in this pandemic world that we're in, things have changed a lot for primary care, and this is going to be our normal for a long time, I think. And the pressure, we all know the pressure on the health system prior to COVID was huge, but also certainly post-COVID and lockdowns and isolation and a reduction of face-to-face consults, things have changed a lot. So what we do know now is that this far down the road, routine screening is impacted, secondary treatment of chronic and acute health issues have been impacted, and people's physical and mental health issues have been impacted greatly, especially in the last 2 years. So it's a really interesting sort of time for people in general practice and primary care to see how do we continue to provide healthcare to people in the less conventional method of rocking up to your GP clinic and having a face-to-face appointment. So just a little bit about us, just so you're aware, because some of you may not have heard from us for a little while about these things, but we've got over 600,000 downloads on mobile devices, and that's split over both Google Play and Apple. We've got over 1 million registered patients, which is pretty amazing. And we're only one of 11 platforms that the Ministry of Health have a sponsored data program for, which means that there's no data cost to access ManageMyHealth on mobile devices for you or your patients. And that's really feeding into what equitable healthcare is about. So it's for everybody. Our users based on gender sit around 60-40, weighted more towards women, but we've seen that trend to be leveling out over the last couple of years, which is quite interesting. And finally, based on age, our users are very similar. So there is no predominant age group that is shown to be high consumers of the patient portal at all, which is really reassuring for us. And what this all means is that ManageMyHealth isn't really aimed at a particular person or a type of medical centre or people with certain medical issues. It's really well suited for everyone, all ages, genders, stage of life, and levels of need from their primary care providers. So what we want to do today is just to make sure that you're aware of the things you can use and change to suit your practice and make sure that your patients get the benefit of this tool that you have. Now, this is starting off at the very basics, but just in case people aren't aware, the ManageMyHealth icon is found, whether you're in MedTech 32 or Evolution, the icon appears on the toolbar that you can see either next to the patient's name or on the pallet itself. So you can see there that orange means that the patient's not enrolled in ManageMyHealth at all, and it's a good time to talk to them about it or give them a pamphlet or whatever you might have. Blue means that they're not registered to ManageMyHealth, but they might be registered to MedicAlert or Beating the Blues or in the shared electronic health record. So we still treat that like an orange. They do need to be talked to about the portal. Yellow means that they've registered at some point, but they've not activated their account yet. So for these ones, you can prompt them to activate, or you might want to resend the activation email to them. And green is what we're aiming for. So registered, active, using the features that you've enabled for your clinic. So that's what we're wanting to see. So starting off with phone appointments, this has been a fabulous tool, obviously, throughout COVID. A lot of providers are happy to have phone consultations in lieu of face-to-face or video calls. And we've really seen a large spike in people using phone consultations, which is great. So you can access this from your system admin menu. So on the screen here, you can see I've highlighted where it says phone appointment settings. So here you can choose whether you want all your appointments that have blank session names in your appointment template in either Evolution or MedTech 32 to appear as phone appointments, or you might want them to be specific to session names that are called MMHPA, which I'm assuming is ManageMyHealth phone appointments. So that gives your providers flexibility on when they'd like their phone appointments to be available. So for some people, they've got their providers working from home a day or so a week, or even in some practices, particularly in areas of hotspots like Auckland, they've split into teams. So providers split their days into mornings and afternoons where they alternate remote consultations and face-to-face appointments. So you can control how that works in your clinic depending on how you guys are working. Moving on to video consults. So some providers obviously prefer to have some form of face-to-face interaction while offering a remote consultation, which is where video consultations come in, which is fabulous. So this is from this menu here is again under the systems menu. You can see it says video consultation settings. And on this form here, you can see what we recommend, the default recommendations are, but you can change that to suit your practice as well. And if it doesn't work for you, or if you do have a question about how that setup might work better or issues that you may be having, just reach out to us and we can help walk you through that process. So the next one is appointment message. So this allows you to communicate information to your patients, essentially. So it can be set up according to the login type. So it can be, and this is the screenshot here, either for people that have logged in on their mobile or on the website or easy booking. Or you can have a separate appointment message by appointment type. So you can do an appointment message for phone consults, an appointment message for video consults. So you might want to say, if it's a face-to-face appointment, when you arrive for your appointment, please phone the reception and stay in your car until you're directed to come in. Or if it was a phone appointment message, you might write, please ensure we have the correct phone number and have your phone switched on, not on silent, at least 5 minutes prior to your consultation. So it's just tailoring the messaging to your patient based on what the appointment is that they're having. The next one is appointment settings. And so this is, a common statement from practices is that they don't want patients to be able to book in with anyone, or the complete opposite, and they want patients to be able to book in with everyone. So we can support both scenarios or a combination, whichever suits your practice. So for practices where providers are quite firm on not seeing each other's patients, unless they're on leave or something like that, you can choose, and this is under where it says location and provider selection restrictions, you can restrict the bookings to only the patient's default provider. Other practices who don't work that way want patients to see whoever's available. They can choose to have no restrictions, or you might want patients to only book in with their default provider, or some providers that have no restrictions. And an example for practices that use registrars, you might want to direct patients only to their default provider or the registrar that's working in your clinic at the moment. And that also helps to keep their appointment books nice and full. Obviously, they're there to see as many patients as they can. So again, it's not just the settings that you have when you go live with ManageMyHealth. You can come back and change things that might not work for you or might work better in the future. The next topic is patient demographics. So patients who are registered and active users can also update their demographics from their login into the portal. And that's a really good thing for your practice because obviously it's less admin for the receptionists. You can also send a group message, which I'll talk about in a couple of slides, but you can send a group message quarterly to remind patients to update their details if they need to. That saves time for people asking at the front desk to confirm details in person, or if you're printing out consult slips, hopefully not printing out consult slips, but if you are, then you don't have to ask every person to confirm their details. But most importantly, it captures those people that don't attend your clinics very often, because those people often miss out because they don't get that face-to-face interaction with your team to be informed of all of this stuff. So group messaging is a really good tool for that, and making sure that they update their details irrespective of whether they come and see the doctor regularly is a very good thing. Often you find out that you don't have the patient's correct details only once you're trying to contact them for some reason and you can't get through, which is quite frustrating. The next slide is about online payments. So it's such a fabulous idea to use online payments for your practice. Anything that helps to reduce debt in your clinic is an amazing thing, but also people nowadays are so used to paying for things online, it's very normal. So you can set rates for your services all from the system admin menu. So you can see in the screenshot, there's two different parts to it as well. We really recommend that you enable this for at least repeat prescriptions. So many practices have issues with patients, particularly those that request a prescription but don't collect it, then not paying for that repeat prescription. And it's really hard once someone doesn't pay their bill to recover that money. It takes a lot of time and effort. So we want to help drive down debt write-off or bad debt by asking patients to pay online. And like you can see there, you can choose whether you want to enforce them paying online or just provide it as an option, whatever would suit your practice better. You do need a WinCave account. And if this is something that you do want to enable, we can walk you through that process end to end. So it's nice and straightforward. Right, so into group messaging now. So this is a feature that I think is possibly underrated. It's so useful. So group messaging is a great way to send information to either all of your patients or a portion of your patients via secure mail. So an example would be booster vaccinations are available to those that have had their second COVID vaccination before June. Or if you had decided that you were opening up a Saturday smear clinic from 10 to 1, please call reception to book. That's an example of how you can use the gender and age filters to hit a target group of patients versus sending a notification out to all patients of your Christmas hours and shutdown period. So group messaging is very, very useful. So now on to lab results. So this is an interesting one. Sometimes practices and providers get a bit apprehensive to switch lab results on. They sometimes think that it might create confusion or stress for patients, but in practice, it's completely the opposite. So for the vast majority of patients and tests that are ordered, it's entirely appropriate to publish the result with a quick comment to the patient. And in fact, some lab providers in Auckland here at Lab Tests, patients can request a copy of their results direct from the lab, and so they get their results the same time as the doctor does, with no clinical context whatsoever or comment. So it's something that people are already accessing in some cases. Now you can see on the screen, here's the setup. So there's Evolution on the left and MedTech 32 on the right. You can choose whether you have that switched on, and the date field there is when you want lab results to be synced from. So whenever you have a date range, it's always a good idea to start it from either a day now or a day in the future. We don't recommend doing retrospective dating because obviously you want to give your providers an opportunity to say, as of Monday, all the comments that you write in your lab results will be syncing to the patient. So just to give them a little heads up, that's patient's going to be seeing what you write in the comment section. For patients that are the exception, so whether the patient themselves is not an appropriate candidate to have lab results published in their portal, or you might be ordering a type of test that definitely requires a consultation and a lot of explanation by the clinician, there are ways to manage those exceptions without taking that service away from everybody else. So if that's something that you would like to discuss further, we can definitely talk to you individually on how that can work for your practice. If the clinicians or providers have any questions or concerns that's stopping you from using it, again, just pull us in so we can help understand what they are and clarify things. Recalls. So I had an interesting conversation in the office the other day actually about sometimes if you ask certain people in the practice, how do your recalls go? Are they going well? Is it sort of busy and stressful? And depending on who you ask, the answer will be, no, we've got a great process. It's not a problem. Often 99.9% if you ask the nurse, they will say it's a nightmare. We have huge numbers of recalls to do. And that's, I mean, nurses are very much in the world of recalls. So using ManageMyHealth Secure Mail as a way to recall the patients for their routine screening is fabulous because there's no associated cost to it, for one, but also practices that are really successful in registering a majority of their patients on the portal, it means that they can recall their patients with one click, which is fabulous. So what you've got on the screen there is an example of where the inbox, outbox document setup is in MedTech 32. So all you need to do is have your document set up in a ManageMyHealth format. So you'd have a smear recall for ManageMyHealth. In your recall contact list, click the ManageMyHealth Send Secure Mail, and to every patient that's on the portal, it will, and in that recall contact list, it will send a secure mail recall letter out. A great thing about that as well is that you can see when a patient's received that recall and they get a link to book an appointment in that recall itself. So for someone who is a busy working woman who's getting her smear recall, you'd receive that, you can click a link that says book appointment and I can make that appointment straight away while it's fresh in my mind without putting it on my to-do list that has 600 other things on it. Other things to note about recalls is that it all writes back obviously into the PMS. So then the patients that aren't able to be reached by ManageMyHealth Secure Mail, you can then choose to either use services that are additional charges like SMS or require a bit more time, like printing and posting letters. So next I'll talk about batch registration. And for some of you, especially if you signed up to ManageMyHealth some time ago, you may not be aware of this. When previously you had to invite patients one by one. So usually that would be the receptionist at the front desk that would be inviting patients to come in, explaining what the portal is and that sort of thing. And that's still an option. So obviously you can still do that. But we've adjusted our implementation process in the software where we can now batch register patients, which means we can invite groups of, I think, up to 1,000 patients at once for you. And that doesn't matter if you've joined us 5 years ago or if you're a new customer. So if that's something that you'd like more information on, you just need to reach out to myself, Fran, or Tyson, and we can walk you through that process. It's a really good thing to do. It means that, again, like I said before, it's health equity. It means every one of your patients is getting the chance to take up the service offering, not just the patients that come into your clinic regularly. it's not, they still have to activate, so they are invited to activate their account, but from your end, the admin side is much lighter, which is obviously way more preferable over anything that's a heavy admin load. So it only includes patients that have a registration status of R. You can exclude patients that are under 18 years old, and you can export the list of patients to an Excel sheet. And you can also get a list of people that choose to opt out as well, which is great. This slide here is on patient resources. So this is under the practice menu. And this has got information sheets on lots of common conditions, all aimed at patients. They're managed by the Everybody patient sheets, and they're so good for your patients. They save time and money, obviously, for printing, but it means that you've got a nice place for your information sheets for your patients, all in, we're sort of moving away from the Perspex holders on the walls in your waiting room. And it means that patients have access to them all the time, which is really handy. There's also a link in there now to the Ministry of Health COVID-19 website, which is very useful, especially when you're directing patients who perhaps are receiving unwarranted information or misleading information. You can direct them through to that link there, and it goes straight into Ministry of Health COVID-19 information. So that's really good too. So I thought I'd talk a little bit about how to promote this within your clinic, because this can sometimes be a bit tricky. Often the key stakeholders from our perspective, the people that are involved in the implementation, aren't the ones that are talking to patients about it. So there is a little element of explaining it to your team and making sure they're on board as well. And we know that you're busy, and so there's never really a good quiet time of the year to take on promoting new services and tools to patients. No one's sitting in the clinic twiddling their thumbs. So reminding staff doesn't work that well when you've got a to-do list that's longer than your arms. But we've come across some really good tried and tested ideas that other clinics have done, which seems to work really well. So one of them is in-house competitions. So this is where the front desk have got, obviously they interact with your patients more than anyone else in the clinic. So they're an incredible asset to you, but they tend to be very busy, obviously, as well. So sometimes an incentive to bump this up the priority list can be good. And that can either be individual, so the receptionist who registers the most patients might win, or you might have a target that you're trying to reach by the end of each week. And if they reach that target, they get a free lunch, nice bottle of wine, chocolates, all of the above. So another idea is practices use for their nursing teams and healthcare assistant teams, which is where they pick a day a week. And on that one day of that week, they talk to all their patients about the portal. And so again, it's quite unfeasible to say to a nurse, can you make sure you speak to every patient every day that you see for the rest of this year about ManageMyHealth? But it's okay to ask of that for one day a week. And it might be that I've got 15 booked patients today, and I'm just going to make sure I give everyone a pamphlet, or I might just check everyone's icon and make sure they're registered and only talk to those that aren't. That works very well. And then finally, obviously, we've got a lot of promotional material that you can use, and that's really useful for the front desk or in waiting rooms, bathrooms, treatment rooms. For people that have printers in their rooms, pop a pamphlet next to there, so when the provider's ordering a lab test, they can give the patient a pamphlet with their lab order, and at least they can have a little read of it. So again, it's just making sure that you've got the buy-in of your team as well, because this works really well the more of your patients that are signed on, and you'll start to feel the real benefits, tangible benefits, like the phone rings less and the receptionists are not juggling 6 things at a time every day, the more patients that you have registered on the portal. And for your patients, the level of healthcare that they can access from your medical centre, whether it be face-to-face or remote, is wonderful. So the more people that have access to that, the better. I've just added this little slide in just today because I thought this would be really useful as well. So under the practice menu, you can see there on the left-hand side, the red box, it's got a link called product updates. And this is where we put all of our release notes. So you can see in there, if you, the little blue click here buttons all the way through that links through to our release notes for those functionalities that have come out. So the last one at the bottom for batch registration, it's got all the details in there about batch registration. So if you did want to read a bit more information about it before you contact us, that's the place to go to. And then this is our slide just showing our support lines. So there's obviously practice support. You've got quite a few options there. And then there's a patient support email address there, support@managemyhealth.co.nz. So you can pass that on to patients if they need it. And that is the end of the presentation. So I can see that there's some questions on the chat here. I'll just open that up. And oh, last question keeps crashing. I've got questions, Karen. Okay, so let me just have a look. So Karen, we can talk to you about what Tyson or Fran can touch base with you about phone and video consultations. Can you confirm that the patient's recall message comes up with the recall that it relates to? Absolutely. So if you have a smear recall, the document in your inbox, outbox setup menu needs to be the format Manage My Health, and that's the document that gets sent. So similarly to how you create an outbox document for an SMS template or a Word document, you need to make sure that it's set to Manage My Health. We can always help you with that as well though. Batch registrations, does it work with patients with the same email? So Tyson, you might be able to jump in and answer this, but it does deal with duplicates. Yep.
No worries. Thank you, Holly. Yeah, so I can confirm that the batch registration does not work with patients with the same email in the system. If it does come across 2 accounts with the same email, it will just leave them out and will notify you of the patients that need to be contacted individually.
Okay, so they don't get included in the batch registration?
No, they get rejected.
Okay, fabulous. Thank you for clarifying that. Are there any other questions? I think I can unmute people, but I'm not quite sure. But feel free to unmute yourselves and talk if you want to. Otherwise, you can send us messages on the chat. Cool. So I think if there's nothing else, Tina, that's the end of my presentation. Thank you very much for listening to me.
Karen had another question here, Holly.
Oh, did you? Oh, sorry. There you go.
She's saying if the same email and they have a different login, what I would say there is that each Manage My Health account requires a unique email address to generate that account. So there's no way that 2 accounts could be linked or registered to that one account there, Karen. They would be able to log in the first place, only one of them.
I've got Karen in my room with me here. She's come running in because she's got some questions.
Oh, fabulous.
Hi, sorry, I don't know why, but the chat kept not responding. It was doing very frustrating.
Oh, that's all right. You can ask your questions in real life.
Yay. So you used to produce user guides for all your features, and the last time I got copies was like 4 years ago. Are you still producing user guides? And if you are, can we get them?
Yes, we've just recently done a review of our user guides. So we did have very lengthy documents that went into quite a bit of detail. What we are trying to do now is functional, like how to do X, Y, Z, and a 1-pager on how to do this in your portal. So we've got a series of training guides that we have published that I'm going to share with Tina, and then she can disseminate throughout the group. How we handle that for the wider network, where they're going to be on either on our website or in the portal itself, I can't answer that just yet, but Tina will definitely be able to share them with you. I'll get them out to her this week.
That's cool. Yeah. Thank you for that. And which batch registrations where you say you can register up to 1,000 people. So obviously privacy is in my head, and when people go in individually, they have to show a form of ID and etc. So how does that work with this batch registrations.
Jason, do you want to answer that question?
Yeah, sure. Essentially, the way we're monitoring at the moment is the fact that to be in the practice management system from which the batch registration pulls from, that patient would have already had to be registered inside the medtech. So as long as there's a date of birth confirmed, and patients will be asked to confirm that, and the email, only then will they be validated through.
So you're saying it's no longer an opt-in process like it has been to date? It's
if you use batch registration, then they've got the option to opt out, but that batch registration invitation will only go to patients that have already been verified by the practice.
Yeah, but I'm just saying, so you're saying that the patient will have no idea that they're being registered with the patient portal, that they'll be given the option to activate their account. So they'll automatically be registered and then given an option to activate. Is that correct, or am I getting that wrong?
They'll be notified that they've been registered. So they receive that notification. Yep. And that screenshot that I showed you before was, there's a little opt out there. So they can choose, no, I don't want to do this. And then you can also see which patients have opted out if you want to.
Okay. So it's like the shared key record now, I suppose, but that's cool. Another question, because I actually set up ManageMyHealth in Whanganui, I don't know, it's probably 5 years ago now.
Cool. Yeah.
So there's a lot of changes and I haven't been getting updates on these new features. So that's why I really asked about the user guides as well. And for the longest time with the messaging system, when you set it up with, clinical staff being able to be selected by the patient if they have a clinical question, a lab result inquiry or a medical consultation or whatever it may be. And I don't think it's changed, but to date, you click the list and you get every single nurse, every single doctor, every single person who's registered within the practice management system as a clinician, which is quite frustrating. And I was told quite a long time ago that you would be changing that. So for example, with medical consultations, we obviously only want the doctors to be selected, not all of the nurses and every other person who's registered as a clinician to pop up. So is that going to be changing at all? Because I've been told this for like a very long time that it would be, and it hasn't.
Asfahan, I can see, is on the call, so he is in our product innovation team, and I'm hoping that he's got an answer to you as far as who's on that list. I'm not sure if I can unmute you so you can talk, Asfahan, or maybe you can put it in the chat as well. Oh, here he is. We're just wondering, the list of clinicians, when you send a secure mail, does it show every single provider that's in the PMS, or can you restrict that list to just certain? You can restrict it, Karen.
Just nurses.
Yes.
You can, because I haven't, I've been asking this question for a long time.
Maybe we can touch base with you. We can arrange a time to have a session with you on that, because Asfahan's just sitting with me. He said, yes, we can do that.
Yeah. That's great.
Cool.
I have a few other questions, but just regarding Karen and Bulls did ask about the recalls, and I might get this wrong, but just in the last couple of years, a lot of the practices have been quite frustrated because some of the recalls that have been going through notifying patients have been recalls outside of primary healthcare, like, so I don't know, I suppose you'd say breast screening and other secondary type recalls are coming through the ManageMyHealth recall system, and so patients are like ringing up to book appointments for particular recalls that aren't provided by general practice. And so I've had, and if anyone else can clarify that, that's on there, but that was my understanding, and so a few practices have turned their recall settings off.
That sounds like something we need to look into, because that doesn't sound right to me.
And I did email about it 2 or 3 years ago, and I've continued to email about it, but I don't think I've had a resolution around it.
Okay.
Yeah, Holly, I don't mind jumping in there just for a second. With ManageMyHealth, there is a switch option, an on-off function essentially. And I believe the function that you're talking about there with the recall reminders is a generic recall, which just notifies that if a recall is due, they'll be notified. And that's a separate system to what the nurses would be using. That's a manual system which the nurse would send out to patients.
Yeah,
All I can reassure you there is that it is a setting you can turn on and off, and is customizable. And the conversation would help with that too.
Yeah, I mean, they have all turned the notification, automatic notification option off because, yeah. But I just,
Yes.
I just wanted to know if that had changed at all. But yeah,
we can definitely talk with you offline about whichever practices those are, and we can check. That's the whole point of the session, really, is to and I think we probably can't obviously answer this in practice specific questions in this webinar, but we can definitely catch up with you guys over the next before Christmas if you guys are available, just to go through these sorts of things.
Yep. That's across all practices, that recall.
Yeah, okay. That would be something that we need to look into further, Tyson.
Yeah,
cool.
I have to check my emails, but yeah. Okay. I mean, I do have other questions, but yeah, that's enough for today. So
any other questions that you have, feel free to either go through Tina or and she can pass them on to me, or you can send it through into that email address in the support slide that was there, and we'll follow up with you guys. So just send anything through and we'll touch base.
Sorry, Holly, I just see that Karen put another couple, Karen from Bulls put another couple up about whether, how do we know if patients are linked to MediCalert, and also do we no longer need to ask for a driver's license when they come into the practice?
Yes. Okay, so firstly, the patients, if they're linked to MediCalert, they'll be blue. Their icon colour will be blue. The verification with the driver's license, that is, I suspect, that we did used to tell practices that, so you need to ask for ID to identify the patient, but we now know that you do that anyway when patients register to your practice, and if they're known to you, you can select that as an option now, known to me. So if it's someone obviously that's been coming into your practice for the last 20 years and you've got a scanned copy of their passport on file, you don't need to ask them for ID. If it's someone that's registering to your clinic and wants to register to ManageMyHealth as well, then you're going to be asking them for that identification to register them to your practice anyway. So we don't ask for ID when they join the practice. So do you not have to verify at all somehow the patient?
You do.
When they register? Yeah. So usually there would be a request of a passport or some sort of photo ID that you save on the PMS for the patient. And that's what we're going off, not in the years that I've been here. Okay. That's interesting. Most practices do need to do that. So that's what that's based off. But you still have the option of going through and identifying them individually as well, if that's what you do.
Yeah, usually for eligibility there should be an ID process.
Yeah.
But yeah, Karen, I might have a conversation. We'll have a chat.
And it's Karen from Health Network again. Just regarding Karen's from Bull's question about knowing if they're MediCalert patients, and you said the icon will come up as blue.
Yes.
So does that MediCalert blue icon override the green patient portal icon? So
no, I don't think so, Tyson. You can correct me if I'm wrong. It will show green if they're registered and activated in the portal, but if they're not, but they do also happen to be a MediCalert or a Beating the Blues patient or a shared electronic health record patient, it'll show blue.
Okay, so yeah, because back in the day, I think I was told that green overrides everything else, but if it's different now, that's good to know.
No, just to clarify, the green does override the blue and orange.
Yeah.
Okay.
Yeah.
Still the case. Very good.
Yes. So it's more the opposite. So if they are registered, they will be green, but if they're not registered, they'll show blue if they are registered to MediCalert or Beating the Blues.
Cool.
Yep. Any other questions? Fabulous. So if there are any that you think of later, please feel free to reach out. Fran, myself, or Tyson we'll be in touch with anyone that wants to have further discussions on things that we haven't gone into huge detail about today. Hopefully this session was useful at a very high level. We're really happy to receive any feedback on how these sessions are run, so please feel free to send that through to Tina and she can forward it through to me. Otherwise, that will be the end of our webinar today.
Hey, Holly, just I wanted to just say thank you to everybody that's attended, because I know that it's the end of a long day. So thank you guys for logging in, and thank you to all your presenters. Yeah, we'll definitely get everything out, and your contact details, Holly, if that's okay, because I think that would be really useful.
That's fine. Yep.
The practices to be able to contact and have a point of contact so that they can get underway and have more confidence with using ManageMyHealth. So yeah, thank you everybody, and thanks for doing that. That was really good. Thank you, Holly, and everybody.
Thank you. Thanks guys for coming today. Really appreciate it.
Oh, just one other question, Holly. The recording, that will be available for us as well for those that couldn't make it today?
Yes, it will.
Yeah.
Don't ask me how I share that to you right now, but Tyson can help me with that after the webinar.
I got you, don't worry.
Thanks. Yeah.
Thank you, everybody.
Okay. Thanks, guys.
Thank you. Have a good night.
See ya.
Thank you. Bye-bye.
Bye.